Welcome to another episode of Living with FASD. I'm your host, Patti Kasper. There's a phrase, young and dumb, that we all think of, that difficult era in our lives when we are transitioning to adulthood, in which we make some really questionable judgments and sometimes end up getting ourselves into a pickle, right? Today, Dr. Jerrod Brown is going to be talking to us about being wired in such a way that we are extra vulnerable. So it's going to be a fascinating discussion. I hope you'll stay tuned for this candid conversation. This week on Living with FASD, we are joined again by my good friend, Dr. Jerrod Brown. Jerrod, welcome to you. And today we're going to be talking about FASD, our vulnerability to all sorts of bad, nasty, ugly things that can go on. And I'll let Jerrod take it away from there.
Hi, Patty. Thanks for having me back. Hi, everyone. I hope you're well. Yeah, today makes me sad talking about this topic, but it's real. Unfortunately, we know from the research, and I know firsthand from many cases I've consulted on, vulnerability and victimization are very high among people with FASD. And my goal today is to kind of peel back those layers and let's learn about what are these pieces of the puzzle that contribute to this increase in vulnerability and victimization. And if we can understand these pieces, we'll have a greater appreciation, and then we can maybe tailor prevention, intervention strategies from having this happen in the future.
Okay.
So
Let me kind of lay out my take on that, Jerrod, is simply
please.
that people with that prenatal alcohol exposure, oftentimes, not always, but oftentimes we grow up in environments with one or more ACEs, adverse childhood experiences. And where there is one, there's oftentimes more. And there's also that family systems that kind of give us attachment styles that we maintain that vulnerability to further adverse experiences. In fact, research has shown, and the second lay of the land survey, for instance, from the adult leadership collaboration of the FASD Changemakers, shows that most of us who are in our adulthood living with FASD continue to have adverse living experiences. Certainly not childhood anymore, but we continue to suffer or be victimized in various ways. Is there more to it than that?
There's a lot more to it. You mentioned two major variables, attachment and early childhood trauma. Obviously, we got to go back into utero and understand what was going on in utero. And obviously, when we're talking FASD, we're talking prenatal alcohol exposure.
Mm-hmm.
But again, on top of that, was birth mom using other drugs during pregnancy? Was
Often.
she smoking cigarettes?
Mm-hmm.
Was she in a domestic violence situation herself? Was she living in homelessness? Was she dealing with medical health issues during the pregnancy and she didn't have proper care? Was she dealing with malnutrition or chronic
Chronic
obesity?
stress.
All of that
Mm-hmm.
plays in. It's not just the alcohol that damages the brain and body of that developing baby in utero. It's all of these things, environmental pollution exposure. I mean, the list goes on and on and on. And then the child's born. And what do we know from the FASD research? Like you said, most kids with FASD have also had adverse childhood experiences. And if you're not familiar with that term, basically what that is, the first study in that was published in 1998.
Mm-hmm.
Since that time, countless studies have looked at different dimensions of this, but in a
Yeah,
nutshell,
that first one was a huge study from
yes,
Kaiser
yes,
Permanente in California,
yep,
in San
yep.
Diego. Yeah,
Involved about, I think, 17,000 participants,
yeah.
Northern California. Basically, in a nutshell, the ACEs research shows the higher numbers of traumas that happen to that
Mm.
child before the age of 18, it has a dose dependent relationship, which is a fancy way of saying the more of those bad things that happen, the greater likelihood that person grows up might be more overweight. They might be more likely to get cancer. They might be more likely to have diabetes, depression, anxiety, broken bone histories. I mean, the list goes on
A
and on and on,
lot of health impacts from the
without a doubt.
chronic stress. Yeah.
And stress, chronic stress, chronic trauma, from a
Hmm.
neurobiological standpoint,
Hmm.
what could be going on in the brain and body? Well, our hormones are off, our neurotransmitters are off,
Yeah.
our amygdala is probably not working properly. We know everyone with FASD is going to have executive function impairments where we want to look to the frontal lobes. And that's a huge factor with vulnerability and victimization because if someone has executive function impairments, planning deficits, reasoning problems,
Hmm.
problems with abstract reasoning, connecting the dots,
Being
maybe
able
the
to choose between options, right?
heck yeah,
Is this a
absolutely.
safe option compared to this one? Which
Yes,
is going to
yes.
keep me safer? If we can't make those determinations accurately, that's a huge vulnerability right there.
A big thing I see in the cases I've consulted on is developmental immaturity, which we'll talk more about that in a minute. But most people with FASD, everyone's different, of course, but most people with FASD function lower than their
Mhm.
chronological age.
Yeah.
What I've seen in the research, a lot of places always say, well, just assume it's half their chronological age.
Mhm.
I don't know if I always agree with that. I mean, I know plenty of people with FASD who are highly intelligent, but they have deficits in different areas. But I've also seen it where they do function
Yeah.
way lower than their chronological age. So that's a big factor.
Well, the other piece with that, I mean, and we used to call this dysmaturity, right? And draw
Yes.
the
Yep.
comparison with immaturity, where with immaturity, we have the ability to snap out of it and act as if we are our chronological age. But with dysmaturity, we can't. Um, and that term really has fallen out of favor because, because there's that connotation that comes with dis anything, right? It's stigmatizing. But if we think of a different developmental timeline compared to the chronological developmental timeline, it's like going to an airport and you can walk in the hallway or you can walk on one of those moving sidewalks.
Yeah. Yeah.
You know,
I'd pick the
they
moving sidewalk myself.
right? I do too, but that's our chronological age, whereas emotionally and developmentally, we may be hoofing it on the concrete that doesn't move.
And I think when you think of that, let's break down immaturity, disimmaturity, whatever you want to call it, developmental, emotional, social age. So if we look at it through a vulnerability and victimization lens, what is that person's level of emotional maturity like?
Mhm.
There's a case I consulted on in the last year, and the client was a female adult. When she was regulated, you couldn't tell she functioned a lot lower, but when she got
Mhm.
really stressed and things did not go her way, her emotions just came flooding out, and it seemed like
Mhm.
she acted like a 5-year-old.
Yeah.
Tantrums, yelling, screaming, throwing things, making
Yeah.
threats when she couldn't find her cell phone. That was an example. So when things go really smoothly and things are calm, a lot of these deficits can be masked. So think about emotional maturity.
Yeah.
What about behavioral immaturity, where the client isn't picking up in maybe a group setting that their behavior just doesn't align with the age of that group? There's another case
Mhm.
I consulted on where the client was in a group. It was like a hobby group, and no one understood FASD in there. The client ended up getting asked to leave that group because the behaviors were just so alarming. It was like a lot of childlike behaviors in
Mhm.
that group of teenagers.
Yeah.
So we got behavioral immaturity. We know about poor cognitive control. You and I have talked about that a lot.
Mhm.
Executive
Mhm.
dysfunction.
Yeah.
Metacognition, which we can go deeper in the weeds. I do know that's going to play a role in vulnerability and victimization. What is metacognition? It's the ultimate executive function. It's thinking about thinking,
Mm-hmm.
knowing about knowing. So when someone with FASD has metacognitive impairments, which they will on some level, the research is very clear on this, the person is going to have a hard time picturing the bigger picture of the situation. They might
Yeah.
just zone in on a laser pinpoint
Yeah.
focus and they're not having good perspective taking what's going on over here, over there.
Can't see the forest for the trees.
Absolutely.
Yeah.
This goes to the heart of problem solving.
Yeah.
This client, this is another case I consulted on. I don't think it was an FASD case. The client had a neurodevelopmental disorder. He lived independently. He was an adult, but he had a lot of in-home support.
Mm-hmm.
And how he had a victimization history, very vulnerable. He was at the bus stop. He met someone for the first time. In his brain, I talked to this person for the first time. We hit it off. Now we're best friends. He had that person
Mm-hmm.
move in with him,
No.
didn't know anything about him. As you can imagine, it did not go well. It
Yeah.
was very, very, very bad. That's all I'm going to say there. Metacognition also plays a role in self-evaluation skills.
Yeah.
People with FASD have a hard time with self-evaluation. Like you kind of mentioned this. Do I go down that dark alley and I don't know anybody here? I shouldn't be out at night. Do I go into that chat room
Yeah.
with a bunch of underage people? I've consulted a lot of cases where the client with FASD gets in a chat room with underage people and starts communicating. They're not connecting the dots that they're over the age of 18, even though their brain is telling them it's okay to talk to a
These
14
are
or
my
15 year
peeps. They're
old.
into the same thing I am. Yeah.
Do you know anybody that ever makes the same mistakes over and over and over again? Of
Mhm.
course, that's a metacognition problem. And if that person gets in the same domestic violence kind of pattern relationship over and over and over again, there's a lot of factors involved there. And I'm never pointing blame at anyone. But that's partially related to a brain-based problem of metacognition. I'm not connecting the dots
Mhm.
that this is a dysfunctional pattern, even though I've been in this dysfunctional pattern
Yeah.
repeatedly, relationship after relationship.
That's a huge topic in and of itself. It's
Yes.
and and that's a common theme in many populations of work. I'm thinking, AA and NA and that standard advice. Stay out of relationships for the first couple years that you're sober so you don't set up, more dysfunctional relationships. And it's easier said than done. That comes from having neurological impairment thanks to the
I've
alcohol.
maybe, Patty, I'm curious in your thoughts on this, but I've consulted on enough cases where I see the topic of codependence come up so much.
Mm-hmm.
The minute I'm out of that just terrible relationship, I'm in the next one within minutes or within an hour. Even
Mm-hmm.
though maybe I don't even know this person, I met them online and they live in a totally another state, but
Yeah.
now I'm identifying as being in that relationship with them. And
Yeah.
it's that fear of being alone. Maybe I hear that consistently. Is it
Yeah.
more intense in someone with an FASD diagnosis? Maybe I'm seeing that pattern, but I don't know of any research that's really looked at that specifically. Maybe there has been, but I'm not aware.
I don't know that any research specific to, codependency and FASD, but it would
Mm,
not surprise me. And I do think it needs to be teased out. But, this is kind of the subject of a book that is on my horizon that, looking at FASD and adult children of alcoholics, and it's not that all of us are the children of alcoholics, certainly not.
yeah.
But and that's also not to say that all children of alcoholics have FASD, certainly not either. But the two do go hand in hand. And I think that's why just the 12-step process alone for the AOCA, you know, cohort of people, 12 stepping alone is not enough. There needs to be a lot of the understand yourself through the FASD lens.
Patty, a big thing too is going to be social intelligence,
Mm-hmm.
social cognition, and social skill deficits. So social cognition's that big umbrella term. And then if you look at the things under that umbrella, empathy, theory of mind, group decision making, those are classic deficits in folks with FASD, according to the
Yeah.
research. So social cognition, do I understand social cues? Do I understand information in the social realm?
Yeah.
I'm sure all of you have heard of emotional intelligence, but part of that is social intelligence.
Yeah.
And if you look at that body of research, it does talk about social immaturity. So some cases, people with FASD, let's just pretend the client's 20 years old chronologically as FASD, but their friendship group, they're hanging out with a bunch of 15-year-olds or
Mm-hmm.
16-year-olds. They function a little bit lower.
Mm-hmm.
Social intelligence also relates to social unawareness. So
Yeah.
I'm not picking up on the fact that these people I'm hanging out with are really hanging out with me to make fun of me or take advantage of me. This
To use
also
me.
relates,
Mm-hmm.
yeah, just being used and
Yeah.
abused, bullying, vulnerable, all
Yeah.
those things. Social intelligence relates to social communication, social problem solving, perspective taking, and even relationship building and cooperation and turn taking.
Yeah.
So if any of you are ever wanting to really learn about FASD and vulnerability and victimization, and if you ask me what's one area to really dig into, that social intelligence lens, the social skill deficits lens.
Yeah.
Because if you really look at the literature on FASD, lack of stranger danger is a huge factor.
Yeah. Yeah.
Big time.
The
And that's scary stuff.
inability to read other people's true intentions.
Yes, yes.
Right. And the people that would abuse people's trust are so skilled manipulating. Those perpetrators are so skilled at manipulating even those who are neurotypical. We are that much more vulnerable to being used that way. Yeah.
Why is that the case? What are a couple other things you'd want to consider when we're thinking about this? Suggestibility. I've
Mhm.
done a lot of publishing in that area of FASD and suggestibility.
Mhm.
The available research says that folks with FASD are typically way more suggestible,
Yeah.
which then they're easily talked into doing things.
Yeah.
They're more prone to confabulate. If they do enter the criminal justice system, it could be a recipe for false confessions and all of those things, which we've talked about on previous episodes.
Yeah.
Have you heard of the term credulity?
Yes.
Okay. So that does come up in the FASD literature a
Let's
little bit.
define that for the audience.
You bet. So look at some of Steve Greenspan's work.
Mhm.
Phenomenal individual.
Yes.
He talks about that. Natalie Novak Brown has talked about that. Phenomenal expert
Yeah.
in the area of FASD. I love learning, reading their literature. Basically, credulity is that willingness to believe or trust too easily, where that person just
Mhm.
almost believes anything, which is, I think, very, very close to being highly gullible and
Mhm.
highly naive. So when you're studying
Mhm.
FASD, you'd want to learn about suggestibility, fragility, and gullibility, to name a few. And we all know what gullible is. If you, yeah, I know what gullibility means, but if you were to really dig into that term, think of it as a vulnerability. If someone is highly gullible, I've had friends, I've had family members when I was growing up, I would prank them and tease them. They were gullible. I mean, we're just having a
Mhm.
good time and stuff. But if someone is really, really gullible, it is a vulnerability and it is the opposite side of the spectrum of having high skepticism. So if
Yeah.
someone's really skeptical of other people, it's probably a protective factor against being taken advantage of on some level. So
Yeah.
gullibility, think of it as it's going to be more of a social skill deficit. They're being tricked easily, they're
Yeah.
manipulated, they're cheated out of things. And I see
And
this in the online world a lot too.
exactly, that's what I was about to say. The
Yeah,
online world or all the spam phone calls. And now with AI, that danger
mhm.
is really ramped up
I
because
know.
you can get AI to mimic your voice, right? And how many scammers now are contacting the elderly, for instance,
Oh,
and playing a message of their loved one's voice saying, I need $500 or several $1,000s, wire it to such and such. They do it because they love the person and they want to help. And we, with FASD are also very vulnerable to that.
I get these emails, I'm sure we all do, like from my bank. I get an email from my bank and it looks so legit. But there's a little bit in me that something doesn't feel right here. So I call my bank. Sure enough, they did not send it. I'm glad I didn't click on the link because it could have gotten the computer and like did all kinds of things to it.
Yeah.
Someone with FASD a lot of times might click on that link or might, again, like you said, send that money or might
Yeah.
believe that person on the other line really
Yeah.
cares for them, loves them, wants to be their boyfriend or girlfriend, just as long as you send me $100.
Yeah.
I have consulted on cases where that very thing has happened and it's sad and
Yeah.
scary and it's not a good thing. So yes,
Yeah,
that's a
or
big, big
trust
thing.
me, the folks at Meta are not going to use Messenger to communicate with you about your account being in danger.
Be skeptical,
Yeah,
fact check, verify. That's one
yeah,
strategy. Teaching clients with FASD safety skills,
yeah.
coaching it, modeling it, teaching it, role playing, having that external brain, whatever word you want to call
Yeah.
it. Some people with FASD do well having a rep payee and guardian in
Hmm.
some cases, a really close mentor who's going to help guide
Hmm.
them in the right direction. Put those extra safety precautions around because vulnerability and victimization, unfortunately, are alive and well. And it's like you said, it's not just for kids with FASD, it's for adults as well. And I think there's a strong argument to be made. These issues might go up as that person gets older,
Hmm.
especially as they move out of their parents' home, caregivers, they don't have the school support. Now they're on
Yeah,
their own. Maybe they live in a group home, maybe they live independently, who knows?
yeah.
That risk of vulnerability goes up, I think, in some level as we get older because
And
of
it's
those lack of support.
yeah, and it's important also to keep in mind that um, our vulnerability and our quote unquote intelligence don't necessarily line up, right? There's that tendency toward judgment. You should have known better. Anytime should creeps into the language, it's judgment and it's not helpful. There are times in life where we are going to be more vulnerable just because life happens and life is messy and life is painful. And whenever we are in a time of a loss of some sort, or as AA would put it, halt, hungry, angry, lonely, tired, those are all times we're going to be vulnerable to making poor judgments or not having the resources to put the brakes on impulses or anything else. Those are times of extra vulnerability. So those are times that we have to ramp up our protective factors,
Chronic
right?
sleep deprivation would be one example where
Mm-hmm.
you go without a night of sleep. Your judgment is down. You're more
Yeah,
vulnerable for any
yeah,
one of us, regardless if it's FASD or not. But can you
yeah.
imagine the FASD brain and they're chronically sleep deprived day in and day
Mm-hmm.
out?
Mm-hmm.
It's just fuel on the fire. It makes these things way worse.
Yeah. And like just even driving. Sleepy driving is impaired driving.
Absolutely.
Yeah.
Yep, we're all guilty of it and we're all at
Mm-hmm.
risk. Yes, there's a
Yeah.
lot of car accidents that happen every year in this country because
Yeah.
of people falling asleep behind the wheel.
Yeah. So, what are some things that we can do, Jerrod?
Learn about executive function, metacognition, social intelligence, really go beyond today's recording,
Mm-hmm.
have an appreciation for those topics. Those are core issues in the world of FASD, and it does play a role in understanding vulnerability and victimization.
Mhm.
Getting that proper diagnosis. Look at some of the early literature on FASD and protective factors. Getting an early diagnosis as early on in life as possible. Getting early support intervention, working with a good therapist, case manager, educating the family members, finding that multidisciplinary team of FASD informed
Mhm.
professionals.
Mhm.
Don't just rely on the client's yes or no response or the verbal head nod.
Yeah.
Fact check, verify,
Yeah.
be aware of the topics of suggestibility, vulnerability, naivete, and even confabulation, because these are all things that come up very frequently
Mhm.
in this world, and really put some safeguards in place if possible. Having that external brain, having that
Mhm.
support system in place. Maybe the client's living independently, but they need some extra support with money management. They need some extra guidance with how to go online and be safe. That is a
Mhm.
huge issue
Mhm.
that comes up. I get emails about
Yeah.
that frequently from different people who have heard me on different podcasts, and it's a topic that it's scary.
Mhm.
Parents need more
Mhm.
training on this. Like, how do I keep my
Yeah.
child or even teenager or adult safe in the online world?
Yeah.
That is an area to take a look at. I think we've done some talks on that too. So I recommend folks going back
Yeah.
and listening to some of those
So
topics as well.
yeah, I have a playlist on my YouTube channel with episodes that are just yours.
Wow, awesome.
So one thing I love about you because I identify as a fellow nerd. I love research. I love reading, right? And I thought I was a really dedicated, professional, lifelong student until I met you. And now I realize I've got a long way to go.
We're all learning together, my friend.
Kudos.
No, we're
But
all in this together, I promise.
for the for those that don't have the luxury of being able to do deep dives and self-guided exploration into these topics, is there one or two books that you would recommend above others to help people out?
I stay away from recommending the certain books. I know you're in that world more. You have some good recommendations in the book world in terms of topics in the research journals. Definitely. And those podcasts we've done,
Yeah.
looking at some of those, and a lot of those are very intentional why we're doing them because they
Mm-hmm.
really complement one
Mm-hmm.
another.
Yeah.
We didn't talk about alexithymia today. We didn't talk about theory of mind today. You need to understand those topics.
Yeah.
They
Yeah.
play into this topic here as well.
Yeah. As well as and I always stumble on this word, anosognosia.
That's really good.
The,
Yeah. So
was I
in the
close? The
I
the
think that's
denial
I'm
of
gonna say
having
that's
a
spot on.
a disorder or disease or whatever, right? The denial of having a condition, whatever that
No, it's
condition
it's
is.
not denial. It looks like denial. Denial is self-protection.
It's the lack of
Anosognosia.
awareness,
Yes.
the
So
the
something in the
inability to
brain.
perceive it.
Yes.
Yeah.
So
Yeah.
as far as I know, and again, I never say I know all the FASD literature. There's been thousands and thousands of studies, but I'm not aware of that term showing up too much
Yeah.
in the FASD literature. But if you know the term anosognosia,
Yeah.
and if you know all the things that go under that umbrella, the terms show up all the time. You will find that term show up tons in the Alzheimer's literature, brain injuries,
Yeah.
schizophrenia,
Yeah.
bipolar. So just pretend, okay, anosognosia, someone has schizophrenia. The person absolutely without a doubt believes, I don't have schizophrenia. The
Yeah.
doctors don't know what they're talking about. My family doesn't know what they're
Yeah.
talking about. Why am I being forced to be on meds? Why do I have
Yeah.
to go to treatment? There's nothing wrong with me. Everybody else is crazy. I
Yeah.
am going to, and then they get mad and
Yeah.
conflict. I do
I
think that's
just
an issue.
consulted on my first FASD case where the proposed client, yeah, was definitely anosognostic.
It's a top, and I don't think we've done
Yeah,
a specific one on that. I've given a lot of
yeah,
professional talks, but I think it'd be worth at least introducing all of you to it because
yeah.
anosognosia, it's partially related to metacognitive deficits,
Mm-hmm.
self-awareness deficits.
Yeah,
And if
yeah,
that client lacks any insight into the fact they have that diagnosis,
yeah,
what does the research say? Well, it could increase vulnerability and victimization, homelessness, criminal justice involvement,
yeah,
emergency room contact,
yeah,
confusion with family. And it's a tricky, tricky topic.
yeah,
I can give lots of tips in the general anosognosia literature, but the caveat is I don't think it's ever been empirically tested with a specific FASD population, which it
right,
should, because
right.
it does come up. There's no
Yeah,
doubt about it.
yeah. And it just creates a whole other layer of pain for family members. Yeah,
Pain, stress, pulling out my hair. Why won't my family
yeah,
member just
yeah,
listen? I'm trying to help them.
yeah.
And then
But
it,
you
yeah, go
are
ahead.
right, though, because I do have a book recommendation when you were talking about the social IQ, right? Social intelligence,
Yeah.
um, that kind of thing. Not too long ago, it was probably in July, put out, yeah, it was in July, put out 2 episodes in a row with Carl Jung and Joel Shagrin, who co-wrote the book Embracing Hope. And they had some wonderfully practical suggestions for how to help family members, with to function better in those areas, to be less vulnerable, to have less friction in their relationships because of those impairments. So,
Both wonderful
yeah,
individuals, know them both. Yep.
yeah.
Wonderful
And
job they
it's a
did on that book.
great book. Yeah, it's a great book.
Yeah.
Yeah. So awesome. Well, I know that you have another meeting coming up pretty quick, but this was a really timely and very important topic. We are very vulnerable to being used and abused, starting in our youth, and as I've pointed out in trainings, in school with FASD, we're bullied, and people take advantage and turn us into the butt of their jokes. The older we get, the bigger the bullies get, and the more serious are the stakes. When eventually the criminal element will take advantage and leave us as the ones that go to jail.
All
Yeah,
too true. All sad too, but
yeah, yeah.
yes.
So it's a very important topic. I'm very glad that you were able to join me today for this. And hopefully, this was eye opening and gave people a lot of really good things that they can start researching and looking up, and maybe going out and getting Carl and Joel's book.
Thank you, Patty, for having me back. Appreciate
Yes,
it.
I appreciate your friendship and your being a guest on the show from time to time. I just love having you on.
Likewise, my friend. Thank you.
All right, take good care, Jerrod. We'll see you again.
Talk to you soon.
I hope you've enjoyed today's episode with Dr. Jerrod Brown on FASD and vulnerability. I hope that you've gained some insights and gotten some really good ideas at keeping yourself or your loved ones safe. Please check the show notes for a link to the book that I talked about, written by Carl Jung and Joel Shagrin, Embracing Hope, because they talk about some very practical things that you can do to increase social awareness, social intelligence, and safety. So be looking for those, and please be sure to like and subscribe and share this podcast, because that is how more people find living with FASD. Thank you for joining us today, and I pray that you have a good week and join us next week for another candid conversation.